And I also said I would never be that girl to cry on YouTube. Upside down Bedrest, because I did make it far enough to have my healthy baby boy. It makes me so emotional because so much goes into like your mental health when you're ill. Let me get comfy. I'm so nervous. Hey mamas, welcome back to A Mama's Guide. I'm here with a story time about when I gave birth to my son and the pregnancy journey. So you're watching this video because maybe you're prone to miscarriages, or maybe you've had insufficient cervix or incompetent cervix or short cervix in your pregnancies, and I just want to hear thoughts from other people. So if you've seen any vlogs, I'm a high-risk mama. I take pride in that. And I have a healthy born son who is 4 years old now, so that's just a disclaimer for this video. My successful pregnancy was 4 years ago, so take that with encouragement. Like, this is good because progress has definitely been made since then. Technology has grown since then. There's so many different findings, but also take note that things may change. Things they did with me, they might not do it anymore. They might find that it doesn't work anymore. I was diagnosed with incompetent cervix, meaning my cervix didn't stay long enough or didn't stay close enough eventually for me to go full term and have a viable baby. I put up air quotes because I did make it far enough to have my healthy baby boy. So let's just dive right in. It got to a point where the baby could be viable, and throughout this time different doctors were coming in like, what are some things you did? How did you make it when you already dilated? How did you make it another month? And then I made it another 2 weeks, and it's like, how are you in month 7 when your cervix shortened at month 5 and you started dilating and you're 5 centimeters? Like, that's active labor. Usually for these videos I have like written notes, organized topics. I'm just gonna speak from the heart and do this in the story time trend. So just forgive me if it's less articulate than my other videos, or like not as organized. Let's just start from the beginning. So I found out I was pregnant, and each appointment went great until the appointment where they did the full sonogram. So there comes a point in your pregnancy where it's transvaginal. At least for me, it was transvaginal at the time. Again, this is 4 years ago. And they measure all the different parts of the baby. So when you reach that stage of your ultrasound where they do the full measurements of all different parts of the baby, their foot, their back, whatever is measured, they also tell at this point how your cervix is doing. So all my appointments were great. Baby's healthy, baby's fine, mommy's fine. By that appointment, when they measured my cervix, I was told my cervix had already started shortening. It was not good news. I was so sad because I just want to keep it real, right? So I want to give you facts, but I also want to give you like a real life person's experience, because sometimes when you hear other people going through similar things, it starts to make you feel like comfort, not misery love company kind of thing, but just like, I'm not alone. So it was horrible news for me, and I didn't take it well. In fact, they thought I would give birth like, let me not skip ahead. So when I was told this, they sent me to labor and delivery the same day. So mind you, the baby is not viable at this time. It's so early in my pregnancy. I believe I was 5 months. Okay, I might take deep breaths just because remembering these trying times, very hard. So I feel for anyone watching this that has been through it, that is going through it, that knows somebody that's been through it. It takes a lot of strength. So they rushed me from the ultrasound room, where I just thought I was getting pictures, to the labor and delivery floor. So I was there and I stayed. An OB came in and she did a pelvic exam. Something told me that this should not happen. Like, if you're telling me my cervix is short, but you know, we believe that like with the pelvic exam, they're not going that far up. I just don't think that everything is a science fact. Like, I believe in miracles, I'm spiritual, I believe in God. So, you know, I'm just like, you know, I went from an ultrasound room to labor delivery room. So now I'm preparing myself, like, am I going to give birth now? And I say give birth because I was already feeling kicks at this point. I already had an attachment with my son, and it's not just like the fetus, right? It's already my son. I already felt his kicks. I already know his routine. I know that he stays up all night and is still in the morning. So I had to train my mind, like, you might give birth, queen. The baby might not make it, queen. And there's a chance that you might not give birth. I'm not sure if I said that right. So it was just a lot of like mental prep for it. Different things worked into place for me when I needed that support the most. So I got the news, I gave myself a mental pep talk just to expect nothing really, because it could go any way, because when people make plans, God laughs, right? So it's just like, you know what, this can happen, but also this can happen, and it could be like a, what the heck, how did you survive it, right? So she did the pelvic exam. I had a bad feeling, like, I don't think this is supposed to happen. If you're saying that, you know, I didn't really understand, and I was ignorant to what incompetent cervix meant. This happened all the same day, so I didn't even get to Google and research it, right? Even though they tell us not to Google. She went inside, and I can just feel like something come out, something drip out, pour out. I don't know, but something was wrong. It felt like maybe like heavy discharge. I think I saw her hands with blood. It's just so hard to talk about this, but I keep putting this video. I put this video off for 4 years now, let's say that. When you talk about personal things, you kind of like open up room for judgment, and I'm just gonna keep putting that to the back burner. Whoever gets help from this video, it's all about you, boo. Right. So in this moment, I'm scared, but I'm not crying. I'm just like, what's happening? So I asked her, like, what's going on? Is everything okay? Even though I know it's not okay. She tells me, I'm sorry. I don't know if she said my mucus plug was out, but I just know she said, you know, quite frankly, you're going to have a stillbirth, and I need you to prepare for when this happens. I need you to be ready. I understand that she's doing her job, and I understand what comes with the territory of being like an OB, or being a doctor, being a therapist even. Sometimes you kind of like desensitize to try to get the facts out, and it helps you do your job better. So I'm not gonna say, you know, but part of keeping your baby, you will learn by the end of this video, if I stop dragging it out, minimizing the stress. So the way he presented the information to me maximized the stress. There was no possibility, there was no there may, it's possible. My heart dropped to my stomach. I called my mom. It's like, I need you to come here. They're telling me I'm gonna give birth and I have to be ready. I just remember praying. Even if you're not a believer, this video is not gonna solely focus from a spiritual or faithful point of view. But I'm just gonna be honest with my story. So I'm praying and I'm saying, God, please, if this is where my journey ends, help me to be prepared for it. Help me to have the strength to go through everything, because when you have that relationship with someone you've never met, it's gonna feel like a grieving process, and other people might not understand that. But I already know what's in my heart, and that's what I felt. So I was like, God, please help me to make it in terms of like not wanting to give up after I possibly go have a stillbirth pregnancy. Oh my god. So I'm sorry, I didn't wear concealer, and I also said I would never be that girl to cry on YouTube, but I really just wished that I had more videos about these kind of stories, because it always felt like something was missing when I did the searches for like how to prevent preterm labor, how to deal with incompetent cervix, especially from a girl that looks like me. So I'm gonna be that girl that's crying on camera, and I'm gonna make jokes about it because that's my coping mechanism. All right. So I wanted to prepare for possibly grieving or losing him. And I was just calling on God, like, okay, so I understand what's happening. Please prepare me. Please give me strength to keep wanting to be alive, basically, like to keep wanting to live and just not give up on life if this is the path that's laid before me. I also prayed for a miracle, and I prayed that, you know, please, I pray that I always say in terms of health, I say like, bless the minds and hands of those who are taking care of me right now. So I don't only pray for myself. And I was taken to the room. I did not give birth. They put the contraction belt on me. I don't know what it's called, girl, but they measured the contractions and was just trying to check how close they were, because it was just like, girl, you about to go in labor within 48 hours. This is 5 months pregnant. They did give me a steroid shot. She was very frank with, it's slight to none that, you know, the baby's not gonna survive. I will still give you this steroid shot. It would kind of like speed up development with like the brain, or was it the lungs? I'm not sure. But I was taking everything at that point. Sorry. So we did this. Turns out I did not have the baby. I was sent back home, but I was told that I could still work, and that bed rest was not a proven. There's no proof that bed rest works. Just go about your day, and if anything happens, come back. I did bed rest. I did not go to work. I totally disregarded the advice from the doctor, from that specific doctor. I understand that some people may not have the opportunity. I don't even want to say privilege or luxury, because it wasn't a luxury, but I understand. Maybe be particular with my words. A lot of people don't have the opportunity to miss out on work. I was ready to give up everything, and I did have the opportunity to do that. I chose to move in with my mom, did not go to work. It was also the soon-to-be COVID, but that didn't happen yet. So I stopped going to work, stayed at my mom, because I was doing full bed rest. I only got up to shower and use the bathroom. So I watched TV in the bed, I went on my phone in the bed, and I just did bed rest at home. If you do have to go to work, I would like say maybe sit and take times to lay down where you can. If there's a couch, if you have a car, lean it back and just lay down. So I wanted to be physically like flat, right? Because I didn't want a lot of pressure on my cervix. Again, there's no scientific proof that this works. I'm sorry, my cousin told me about upside down bed rest. I did that at home, where I just elevated my feet on the bed and I kept my head flat on the bed, but my bottom half, my butt, my legs, and my feet, I had a whole bunch of pillows over there. So I was on an incline. These are my feet. This is my head on the bed. My feet are lifted, I'm not just flat. Pause right here. Doing this long term can cause so much complications. When I did upside down bed rest at home, I sat right side up one day. The room was spinning, literally dizzy. My vision was blurry. The room was spinning. It felt like, and I'm just sitting. It felt like seeing stars. And then I just started throwing up. Went to the hospital, not seeing a high risk. OB right now. I'm just saying whoever's in the labor and delivery floor for like emergency care. She's requesting a pelvic exam. I declined. I had to sign a contract declining this to take, you know, like all legal responsibility if something fatal could happen to to my baby or me, that I declined. But my high-risk doctor told me personally, based on my cervix and my health history, he's I don't know if I'm mixing up the timeline, but he said like try to have people go in you as least as possible. But also when you research how to prevent miscarriages, it's still, this is unknown, there's no sure way to present it. That tells you that the research is not final, right? Everything is still up in the air, but there's a lot of knowledge and there's a lot of things that can help you reduce the chances of having a miscarriage, of delivering preterm. So still soak in, absorb all of that information. There's no finite answers of don't do this and this will cause this. Double-edged sword, if you will. I did the Bedrest at home. Hopefully you can do the Bedrest too, or something similar to it. When I realized I didn't give birth, my OB prescribed me progesterone. So this is the time where I had to insert the tablet and lay back flat, insert the tablet into my vagina. Moving forward, I wanted to get this cerclage, the stitch. It's a surgical operation, so it is risky too, because you never know if it can open it more, cause more damage, or if it can save your pregnancy and get you to full term. So everything is still in the I don't know, possibly not kind of thing. Someone in my family, someone dear to me, had the cerclage and they went full term. So I was like, can I just get the cerclage? I don't want to do progesterone anymore. Can I do both of them? I just really want to have this baby. I'm doing Bedrest. You don't need Bedrest. And I'm like, yeah, but I'm doing it. This is a different OB now. This is my normal OB. The one labor delivery was just emergency OB. She wasn't my usual. They also scheduled ultrasounds, I think it was bi-weekly or weekly. This was transvaginal to see how my cervix was doing. We had the same ultrasound tech each time and she measured it. I'm not sure if 4 years later now they still do those kind of ultrasounds when you're having a short cervix, but before that's what they did for me. I was reassured that the prog was not reaching my cervix, it was just staying in the vaginal canal. They said they're not messing with anything down there. I'm not sure. That's possibly discontinued now. And probably they know like, you know, we're not going inside of the girl's vagina every week. So it just depends. We have the same ultrasound tech. This is important because one day we had a different one and she noted a different measurement of my cervix. Measurement matters now because eventually as it shortens, it moves into dilating. So she measured an increase. So it was like, oh my goodness, is like my cervix is growing or the medicine is making it appear longer. With this hope, I was so excited to go back home. I had a new outlook on everything. Came back to my regular ultrasound tech was there for my next appointment. She said it's even shorter than last time. Shorter than the time before. The new tech measured it. So, you know, they decided actually to just stick with that one tech each time. She was very particular. She was very anal about her measurements and we stuck with her. We didn't want anyone else to just confuse it. Who knows who was right, who was wrong? We kept it simple and routine. At this point, I request a high-risk doctor. Everything changed. My pregnancy turned like it did a 180. Everything was totally different. Same hospital, same affiliation. So I had a high-risk doctor. His feedback was so different from my general OBs. And I was just like, how is this like? So I was just spreading the word after I had my son, like, please join high risk, be high risk. Like, just being black, be high risk. Being over 30, just try to get high risk. You know, these different things. I was just encouraging everyone to get a high risk doctor just because they're aware of all these ironic things that can happen, like things that science can't explain. So they know that there's these situations where like miracles almost happen, and they know that like certain things science has improved, but I've tried it, tried and true, because they've dealt with complicated pregnancies throughout their career. So they have a more open mind, and their bedside manner is totally different. Met with the high risk doctor. He was like, "Hey, I understand you requested high risk." He reviewed everything. He said, "I want you first. Can you leave work?" And I was like, "I already left work." He was like, "Perfect. Stay at home. Stay in bed. Can you stay in bed here?" And I was like, "In the hospital?" I'm like, "In the hospital under care? Where you guys can watch my baby the whole time, check if I'm having contractions, give me an IV if I'm not drinking enough water?" Absolutely. So I'm just like, I can be admitted and stay here for the rest of my pregnancy. So by this time, maybe I was on my 6th month, because I spent some time Bedrest at home. I could be 6th into 7th. I'm honestly not sure. So now I'm doing Bedrest in the hospital. He says it's too late for the cerclage. I think that he would have recommended it sooner, like right away, just because of, but you know what, I'm not gonna mind read. It's too late for the cerclage at this point. My cervix was too short. I did begin dilating. So you can say that I was in labor. For bed rest, they told me I can get up to shower. I can get up to use the bathroom. At this point, I was living in the hospital. A month had passed. To keep myself busy, this hospital, luckily, for patients who were on bed rest or admitted long term, different services came in. So someone came in to do yoga with me, like the week of Valentine's. It makes me so. It makes me so emotional, because so much goes into like your mental health when you're ill, even outside of pregnancy. So just having strangers I cry over the most random parts of the story. So having strangers, even though there were volunteers, but having volunteers come in just to keep lonely people. Having volunteers come in, like having that as part of the policy in the hospital for patients who are there long term, really helped to change everything. And just also like the care of all the nurses and the resident OBs, who residents work under the attending. So the attending is the highest, I don't know highest, but I think it's chief attending resident. So my OB was an attending OB. He had his residents, and just them all being part of the high risk department, knowing to speak carefully, speak positivity, because stress can induce labor. The mindset of the mom can affect how long she carries the baby, like different, everything was intentional. And then in terms of having like having the volunteers come, like you can do pet therapy and like pet animals, and it just could seem so silly, but when you're in the hospital, because I was there for a pretty long time, maybe 2 months, I don't know, I could be messing it up, maybe a month and a half or 2 months, I'm not sure. So had friends would visit, but also like your friends could be triggered by coming, and they might break down, and they might not want you to break down, just not, they've taken things personal. I also didn't want anyone to visit, because I didn't want them to see me like how I was, because I did not go home. You know, I did not take a full shower. I did not do my hair. You know, there are times where I didn't want to call the nurse to help me to brush my teeth. It got dirty, you know, it got nasty. And then I tried not to use social media because just seeing everyone's life move forward and me just stuck in the same bed every day, you know, I just try to minimize everything. So having those services, I didn't do a lot. I did one, you know, we did origami. I forgot what we made, but he taught me how to do origami, and he was an older man, and I was just so grateful. With the Bedrest, people came to do physical therapy because I told them that I wasn't walking. My mom tried to stand me up, and I just dropped down on the bed. Like, the nurses helped call, you know, like everyone realized like she cannot stand up. So I was on bed rest for so long that I was immobile. Again, they told me I could go to the bathroom, I could take showers. I said no. I said I'm already dilated. I could have the baby any second now. And I'm only, I think I was 6 months at this point. I was like, I don't want to move. So let's get into some tips on preventing the preterm labor or, you know, miscarriage or stillbirth. These are not proven by science. These are just different things nurses told me along the way. A lot of nurses have seen so much and they get close with the patient where they hear different stories. So I got so much advice from different nurses, especially nurses of different cultures. So like a Jamaican nurse told me about upside down bed rest. She asked me like, why do I have the bed, my feet raised, but on my head am I doing upside down bed rest? And I was like, yeah, I try not to do upside down bed rest so long as I did. Like I OD'd in the hospital. I did it and then I would lay flat. Like I would take breaks each day where I was just laying regular, or I'll have my head upright, because you know the blood rushing to my head, not good. But in times where I felt called to do it, I put, you know, the controls on the bed, erase my feet just so it's elevated higher than, taking off the pressure from my cervix. This is not proven, but this is things I did. Another nurse told me she had several miscarriages and she thinks that something that helped her was not straining to poop. You Google this, straining to poop does not cause miscarriage. You Google something else, straining to poop affects pressure on the cervix and could cause bleeding. So being that my cervix was dilated, shortening, pressure to poop in this case could affect my baby, because it could cause complications with the cervix that was already dealing with some stuff. So this nurse, she didn't explain it that way, but she just said, do not push to poop. Wait for your poop to be right there and let it come out. Upside down bed rest with caution, not straining for a bowel movement. These are 2 things I did. So I would not push, I would not try to get it out. I would literally wait till the last point. And I was not holding it in, because it's common to become constipated. You don't want that, because then now you gotta strain. And it could cause like anal fissures when you get tears and you bleeding in your you know what hole. So I didn't hold it in, but I also didn't push. And by push I mean strain. To get it out you do have to push, like, you know, naturally. But I did not strain. Like, I'm not gonna act it out, guys. I did not leave the bed to go to the shower. I did not leave the bed to use the bathroom. I did bedpans. Since I was there for over a month, I ended up doing the bedpans myself. I don't know if this is a good idea, because there is strain to like lift up yourself, put the pan under you, wipe. But I just personally was like, I'm here so long, I'm just gonna do it. You start not to care about the embarrassment when your main goal is to have a child who's alive. So child, let them change your bedpans, let them do what they have to do. For me, I was just like, I'm gonna take care of this. For showers, my mom came in and gave me a sponge bath on the bed. I wanted so bad to be alone. I didn't want anybody to feel guilty or sorry for me or sad. But those people that said, I'm coming, whether you like it or not, it changed everything. The day, like, I was looking forward to tomorrow. During this time, I was also very hopeful. Surprisingly, I was not pessimistic because stress can cause contractions, and I was practically already in birth, right, because I was dilating. You say a catchphrase to kind of get your mental edge, kind of get those dark thoughts out of the way. I'm gonna think positive, which can reduce the stress, which can reduce contractions. Anytime it came into my head, I had phrases I would say. I rebuke that thought. I rebuke that thought in the name of Jesus. I'm not gonna think that. If you're not religious, I refuse for my mind to go there. None of this is medically proven. This is just what I did. So I'm a person who was dilating at 6 months. I'm saying the same prayer. I pray for a speedy recovery, a smooth birth. Bless the hands and minds of the doctors and nurses taking care of me. Bless the hands and minds of people around me. Cover them. Help them to make the right choices. God, speak to them. Put your hand in their work. And it was just me praying for all the people around me over and over and over, praying for a painless delivery, speedy recovery, smooth delivery, speedy recovery. I was counting down the days. I made it one more day. Now I'm in month 7, still living in the hospital. But I'm thinking, like, what if there's delays? What if there's deformities? And these are not flaws. You're gonna love your baby no matter what. No matter if there's any delays, deformities, anything that makes them special, you're still gonna love them. But these are just thoughts I had in my head. And my doctor was just like, he is viable. He has made it through the threshold. You know, the baby's gonna be good. I did have a gender reveal before I did the bed rest, so I knew it was a boy. I didn't want one. My friends convinced me to have one. You need to feel love. You need to feel appreciated. You need to feel excitement. You need to feel happiness. They forced me to do it because your mental state helps you with your healing. Long story long, I gave birth to my son. I felt no pain, but still did the epidural. The nurses were like, you're insane. You're already at the finish line. I don't know if I was 7 centimeters. I don't know what I was, but they were like, it's already over, girl. You don't need an epidural. You're gonna have this back pain. And I was just like, I need it. I never did this before. And I gave birth. Maybe that could be another video. This one's getting pretty long, but I gave birth to my son, and it was dramatic in true fashion because nothing was regular about my pregnancy. That's about it. Don't screenshot me crying. I don't have a cute crying face, but continue to love on you and accept the love that others give to you during these trying times. It can be so easy to isolate, but you have to make it harder. You have to put in a fighting effort to accept the love and warmth of others because they're not doing it to annoy you. They're doing it because they care about you. And these little moments that could be like, oh, I don't want to be around anyone. Those little moments that they're around you distract you from all the stress and the worry and the frustration. It helps. Thank you for watching. Follow me on Instagram, A Mama's Guide, and my personal Instagram is Queen Sidem. I have some vlogs of my pregnancy journey. I don't think anybody knew what was happening because I didn't share with anyone how serious this was, how I was in labor. But you can take a look at those vlogs, and I show my bed rest at home. I show my bed rest in the hospital. I do like a question kind of video in the hospital. The nurses actually saw me like trying to put on makeup in bed rest and put up my phone. I was a mess in there. I was in there so long. They probably were so sick of me. But anyway, You got this. All the power is in you. Your body will do what it's made to do. Take care. Take care. Do not forget to like, comment, and subscribe.